Did you ever wonder how the heart, a mere fist-sized organ, manages to pump blood throughout your entire body? Let's take a moment to marvel at this extraordinary organ. With an intricate network of chambers, valves, and blood vessels, the heart is a powerhouse, ceaselessly beating an astounding 100,000 times a day. Its relentless rhythm ensures a constant flow of oxygen and nutrients to every cell in your body, making life as we know it possible. However, like any engine, the heart can encounter problems. From congenital heart defects to lifestyle-induced conditions, heart diseases are as varied as they are common. They can disrupt this smooth operation, leading to far-reaching consequences on our overall health and well-being. One of the most common heart diseases is coronary artery disease, which can lead to heart attacks. Then, there are conditions like heart failure, where the heart doesn't pump blood as well as it should. Arrhythmias, on the other hand, mess with the heart's rhythm, making it beat too fast, too slow, or irregularly. But today, we're going to focus on a specific heart condition that affects one of the heart's 4 valves, the mitral valve. When the mitral valve doesn't function properly, it can lead to breathlessness, fatigue, and heart palpitations. It's a serious condition, no doubt. But what if we told you there's a non-surgical solution to it? Enter the world of transcatheter mitral valve replacement, or TMVR, a revolutionary non-surgical treatment for mitral valve disease. This is a realm where medical science meets innovation, bringing hope to those whose hearts need a little help to keep the beat. So, what is TMVR? Let's break it down. Picture your heart with its 4 chambers and powerful muscles, all working in sync to keep blood flowing through your body. One of the heart's most pivotal components is the mitral valve, a small but mighty gatekeeper that controls the flow of blood between the heart's left atrium and left ventricle. When this valve malfunctions due to mitral valve disease, it can lead to heart failure, arrhythmias, and other life-threatening conditions. This is where TMVR comes into play. Transcatheter mitral valve. Replacement is a cutting-edge, non-surgical approach to treating mitral valve disease. Instead of opening up the chest for open-heart surgery, TMVR uses a catheter, a thin, flexible tube, to deliver a new valve to the heart. The procedure is minimally invasive and performed under general anesthesia. Think of it as a kind of medical magic trick. The doctor threads the catheter through a small incision in the leg, up through the femoral vein, and into the heart. Once it's in place, the new valve is deployed and begins to do its job, allowing the heart to pump blood efficiently, once again. TMVR offers a solution to those for whom traditional open-heart surgery is too risky. It's a beacon of hope, a light at the end of the tunnel for patients who have been living with the debilitating symptoms of mitral valve disease. This procedure is a testament to the relentless pursuit of medical science to improve and save lives. But it's not just about what TMVR is. It's about what it represents. The incredible advancements in medical technology, the power of human ingenuity, and the relentless quest to improve the quality of human life. So how exactly does this fascinating procedure work? Stay tuned to find out as we delve deeper into the TMVR process. TMVR might sound complex, but let's break it down together. Transcatheter mitral valve replacement, or TMVR, is a minimally invasive procedure that replaces a diseased mitral valve without the need for open-heart surgery. But how does it work? Let's dive in. Think of your heart as a house with doors. The mitral valve is one of these doors, allowing blood to flow in one direction, from the left atrium to the left ventricle, which then pumps it out to the body. However, when this door or valve becomes damaged, it can cause a number of problems. That's where TMVR comes in. The first step in TMVR is to insert a catheter, a thin, flexible tube, into a blood vessel. This is usually done through a small incision in the groin. The catheter is then carefully guided up through the body's vascular highway, all the way to the heart. Once the catheter reaches the heart, the real magic happens. Inside the catheter is a specially designed, compressed replacement valve. This new valve is tiny, about the size of a dime. But don't let its size fool you. This little device is about to do a big job. Under the guidance of sophisticated imaging techniques, the cardiologist positions the new valve inside the old, damaged one. The new valve is then expanded, pushing the old valve leaflets out of the way. It's a bit like fitting a new door into an old frame. The new valve takes over immediately, allowing blood to flow correctly once more. The catheter is then carefully withdrawn, and the small incision is closed. The entire process is done without the need for open-heart surgery or a lengthy recovery period. This innovative procedure is changing the game for patients with mitral valve disease. It's less invasive, It's quicker, and it offers a new lease on life for those who may not be candidates for traditional surgery. And just like that, the new valve starts functioning, improving the heart's performance. The TMVR process may seem complex, but when broken down step by step, it's a testament to the incredible advances in modern medicine. A tiny valve, a big difference. That's the power of TMVR. But why choose TMVR over traditional surgical procedures, you may ask? Well, let's delve into the significant benefits of transcatheter mitral valve replacement, or TMVR. First off, TMVR is less invasive than traditional open-heart surgery. In other words, it doesn't require a large incision in the chest. Instead, this innovative procedure uses a thin, flexible tube known as a catheter, inserted through a small incision in the leg. The new valve is then guided to the heart through the body's blood vessels. This means less bodily trauma, less blood loss, and less pain post-procedure. Now let's talk about recovery time. Traditional heart valve surgery often requires a hospital stay of up to a week or more, followed by several weeks to months of recovery at home. But with TMVR, the hospital stay is typically much shorter, sometimes as brief as just a couple of days. And the overall recovery period, usually it's significantly less too. This means patients can get back to their daily routines faster with less disruption to their lives. Another major benefit of TMVR is its suitability for high-risk patients. Some people have conditions that make traditional surgery too risky. These might include older adults, those with severe lung disease, or people who have had previous heart surgeries. TMVR offers a safer alternative for these individuals, providing a new lease on life when options might be limited. And let's not forget the psychological benefits. The less invasive nature of TMVR, combined with a quicker recovery, can significantly reduce the stress and anxiety often associated with traditional heart surgery. This means patients can focus more on healing and less on worrying. But, as with any medical procedure, TMVR isn't without its risks. We'll delve into that in our next segment. So, hang tight and stay with us as we continue to explore the fascinating world of transcatheter mitral valve replacement. While TMVR is a game changer, it's important to understand its potential risks. As with any medical procedure, transcatheter mitral valve replacement, or TMVR, comes with its share of risks and potential complications. One of the immediate risks that could occur during or after the procedure is the risk of bleeding. This is because blood thinners are used to prevent clots from forming, but they also make it easier for bleeding to occur. It's a delicate balance that doctors must maintain. Another risk is infection. Despite the stringent sterilization protocols in place, there's always a small chance that an infection could occur. This is particularly worrisome because an infection in the heart can be difficult to treat and can lead to serious complications. There's also the risk of damage to the heart or blood vessels. The procedure involves threading a catheter through your blood vessels and into your heart. If something goes wrong, it could lead to damage that requires additional surgery to fix. In rare instances, the new valve may not fit properly or may not function as it should. This could lead to a leaky valve, which could cause your heart to work harder than it should. If this happens, you may need another procedure to fix or replace the valve. Lastly, there's the risk of stroke. Although this risk is relatively low, it's still a possibility. A stroke can occur if a blood clot forms in the heart and travels to the brain. Now, while these risks may sound daunting, it's crucial to remember that the healthcare team will be doing everything in their power to minimize these risks. They will be closely monitoring you during and after the procedure, ready to respond swiftly should any complications arise. Moreover, it's important to weigh these risks against the potential benefits of TMVR. For many people with severe mitral valve disease, TMVR can vastly improve their quality of life. Clearly, TMVR is not a one-size-fits-all solution, but for some, it can be a lifesaver. So, what does the future hold for TMVR? As we gaze into the crystal ball of medical innovation, the future of transcatheter mitral valve replacement, or TMVR, appears bright and promising. It's clear that TMVR is no fleeting trend, but rather a crucial cornerstone in the evolution of cardiovascular treatment. In the spirit of progress, we're seeing remarkable advancements in the technology and techniques used in TMVR procedures. The development of next-generation devices is paving the way for safer, more efficient procedures, with a focus on reducing complications and improving patient outcomes. Just imagine devices so advanced they can navigate the complexity of the human heart with unprecedented precision, altering the landscape of cardiovascular care. This isn't a sci-fi fantasy, but a tangible reality on the horizon of TMVR technology. Moreover, the future of TMVR holds the prospect of becoming more accessible to a wider range of patients. As the technology evolves, we anticipate a decrease in the costs associated with these procedures. This means that potentially life-saving TMVR could be within reach for more patients than ever before. But it doesn't stop there. The future of TMVR also lies in the realm of virtual reality and artificial intelligence. Picture this: surgeons practicing complex TMVR procedures in a virtual environment before they ever touch a human heart. Or artificial intelligence systems predicting potential risks and suggesting the best course of action during the procedure. It's all part of a future where technology and human touch work hand in hand to save lives. The future of TMVR is not only about technological advancements, it's about changing lives, improving health, and reshaping the way we understand and treat heart diseases. It's a future where the mysteries of the heart are less daunting, and the miracles of medical science are more astounding. So, as we look ahead, we can see that the horizon for TMVR is wide and full of potential. The blend of innovative technology, medical expertise, and a commitment to patient care is propelling us towards a future where TMVR is a standard treatment option for mitral valve diseases. With continuous medical advancements, TMVR is set to change the way we treat heart diseases. So, that's TMVR in a nutshell. We've journeyed through the remarkable world of the human heart, unveiling its mysteries and marveling at the intricate dance of life it orchestrates. We've delved into transcatheter mitral valve replacement, or TMVR, a groundbreaking technique that's transforming the landscape of cardiac care. We've broken down the TMVR process, simplifying its complex procedures into understandable steps. It's a minimally invasive procedure that replaces the heart's mitral valve without the need for open-heart surgery. A game-changer indeed. We've weighed in on the benefits of TMVR, discussing how it offers a beacon of hope for those who are high-risk surgical candidates. Its shorter recovery times, less pain, and the potential for improved quality of life are truly compelling advantages. Yet, we've also acknowledged the risks, painting a balanced picture of this medical milestone. From possible complications to the need for lifelong medication, we've stressed the importance of making informed decisions. Peering into the future of TMVR, we've glimpsed at the promising horizons this field is set to explore. From technological advancements to broader accessibility, the future of TMVR is as exciting as it is promising. In wrapping up, let's remember that knowledge is power, and understanding the intricacies of our health is a step towards better well-being. TMVR is not just a medical procedure, but a testament to human ingenuity and our relentless pursuit of a healthier, happier life. Stay curious, stay informed, and remember, every heartbeat matters.